An 86-year-old man has died from COVID in Queen Elizabeth Hospital, taking Hong Kong's coronavirus death toll to 132. Another 63 people were confirmed to be infected, the lowest number this month. Anya Lau reports.
New COVID cases in Hong Kong dipped to the lowest since the start of December, but health officials remain cautious.
I hope this trend will continue so that we can actually see a downward trend, but I'm still not sure yet.
53 of the cases were local transmissions, 13 of which have an unknown source, and 40 linked to previous infections. One of the latest patients is a doctor who runs a clinic in the Grandeur Terrace shopping arcade in Tin Shui Wai. Wu Xiaochun treated 2 coronavirus patients last week and went for screening last Sunday before developing symptoms a day later.
We cannot be 100% sure whether he's really getting the infection from the patient or from the community. But because there's an obvious link of these patients, so we assume that he's more likely than not getting the infection from the patients.
Tran said health authorities are still tracing patients who visited the clinic last weekend so that they can undergo tests. Wu's clinic is now closed and all the staff will be quarantined. Meanwhile, more infections have been found in residential blocks. There were 7 cases in Lotus Towers in Kwun Tong Garden Estate and 4 in Yun Mei House in Yau Tong. 2 of today's 10 important cases were from Britain. Hong Kong has now banned flights from Britain after a new COVID strain began spreading rapidly in southeastern England. The SAR's caseload has now risen to 8,301. Anya Lau, HKIBC.